Welcome to the Dutch Barton Dental Practice in Bradford and Avon. So come on in. No, we'll move on. If you want some more detail, the issue with printing inlays is the post-processing. As you will have seen, we milled. The design process takes the same, the prep takes the same. The production, the milling, once it's milled, it's a minute or so to get the sprue off, it's already been polished, and then we prepare it, we bond it, we silinate it, we stick it in. With printers, as you know, there's post-processing involved. So realistically, the production process, instead of being between 3 and 5 minutes, is 15, 20, maybe even 25 minutes. And that's a lot longer. But also, you've got a polymerized restoration versus a compressed hybrid block. And I know at the moment I would rather have a hybrid block restoration that's been milled in my mouth. Okay. It depends, doesn't it? You know, we try to be as minimal as possible. I like to remove amalgam. I like to put something like a bonded SDR or a composite in there to give me a nice core. When we're thinking about these things, you've got to think about the minimal thickness of your materials. So that is based on, you know, you look at the manufacturer's guidelines. There are still some people saying that if you're doing ceramic restorations, you're over prepping a tooth. And that's just not right. You know, I was running a course last week and we were all agreeing that to do a PFM or a bonded crown with metal with ceramic on it, you need a reduction of about 2, maybe 2.5 millimeters. With the newer materials, the advanced lithium disilicate Tessera, some of the zirconians we've got now. So 1 millimeter with Tessera and 0.6 millimeters with some of the new zirconians we've got. That's not over prepping. So I would say, I'm going to throw it out there. Bonded crowns, are we over prepping? I wait, I can hear it now. Composite onlay, we etch it, as hopefully you saw. We silinate it, and then I use Calibra Universal Cement. Okay, as I said, some people talk about sandblasting as well. I don't do that. Other people talk about heated composite, and it works. But, you know, we use these expressions, don't we? Operator sensitive in dentistry, and heated composite is operator sensitive. So I do what I said, and that works really, really well. And it's a tried and tested workflow or protocol. One of the biggest barriers to people investing in equipment like this is it's expensive, or they think it's expensive. What does it mean? Buying or investing, you know? And we talk about ROI, or return on investment. What I can tell you is when we first started this many years ago, we bought 2 scanners, 1 mill, 1 furnace and a CBCT. And myself and my business partner started doing it. And our associates literally spent a lot of time looking over our shoulders saying, what are you doing? Within 6 months, we bought a second mill because we needed it. And we now have 3 mills, 4 furnaces, CBCT, a printer, can't remember if I missed anything else. So every surgery has a scanner, and we've also got a Prime Scan 2, which I use. And everybody here does as much as they can digitally. And what I can tell you in terms of my accounts, for the first 7 years of us working digitally, we saw a 25% year-on-year increase in profits for the first 7 years, and that was including the capital investment. And don't forget, capital expenditure is certainly at least 100% tax efficient. So we became more efficient, we became more profitable. So I think we are just about done with questions, so thank you and good night.